More coming in. Hi, Cecily. How are you?
I'm good. You?
Good.
Yes.
All right. So give me just a second and we'll get started. Did you guys fill out the study guide?
Yes, I filled that out.
Okay. All right. Awesome. All right. So I'm going to share my screen. As soon as this is 208. Okay. I just want to make sure I'm on the right class. So 208 exam one review. All right. So for exam one, there's going to be 50 questions. You have 75 minutes to complete the question. And it's going to cover concepts from weeks 1, 2, and 3. So the introduction to community nursing, levels of prevention, your Healthy People 2030, and then the introduction to vulnerable populations, and then concepts from week 2 is school nursing, growth and development, the common childhood ailments, family nursing, family health risks, your migrant workers, your rural population, your homeless, and your poverty from week 3. And so all the readings that were listed for um all 3 weeks and just the different chapters. And I know it's scattered throughout a bunch of your textbooks. So week 1, we did the introduction to community nursing. So community-oriented nursing is oriented around the community or the population. Remember, so like unlike working with one patient, here we're working as with the community as our patient. So the goals here are going to be community-based. It's primarily focused on health promotion rather than illness care, which is again, it's a whole group of people rather than just individuals, right? So example here would be providing education to families about the importance of vaccinations. Community-based nursing. So again, community-oriented nursing is oriented around the community or population, focused on health promotion rather than illness. Community-based nursing is based in the community. All right, so this is illness care of individuals in the community, right? So things like your home health, your hospice care, your occupational, your school nurses, right? What are all of those different roles? Illness care instead of health promotion and health maintenance. All right. So this also is going to be more individual based. So like, providing data on mortality rates to people who may be, unwilling to go get their vaccinations. Public health nurses focus on preventive, not curative services, right? So how do we prevent disease and other issues from occurring? Um, so levels of prevention, right? We talked about primary and secondary and tertiary prevention. So primary is prevention, right? So primary prevention is prevention. What can we do to prevent diseases? So we were looking at preventing the problem before the problem starts, right? Preventing an illness, right? So vaccinations, providing education about wearing proper safety equipment for sports and riding bicycles, seatbelt use, pamphlets for migrant workers on ways to reduce pesticide exposure, teaching stress reduction techniques, all of those prevention, right? Primary is prevention. Secondary is screening, right? So secondary is looking at what are some of the early interventions, early detections, right? Preventing complications, attempt to reverse the course. So routine screenings, right? Your mammograms, your pap smears, your blood pressure screenings, prostate exams, right? We also can look at screening caregivers about how they are doing and suggest coping mechanisms. Right? So we're looking at prevention, preventing disease, and then tertiary is treatment, right? So that's the management of disease to reduce the symptoms, improve quality of life, which could be medications, it could be diet, it could be, checking your glucose levels, maintaining those glucose levels, in our diabetics, in, weight loss for some of our other disease processes. It also could be rehabilitative services, right? Following an accident, injury, or another disease process. Um, you guys have that primary, secondary, until you got that down to a T? Okay. Just want to make sure. And then we have our Healthy People 2030. And so Healthy People 2030, right? What's the relationship between race and ethnicity and health status? So when we look at race and ethnicity and health status, how do those play together? Look at, so a lot of our ethnic and our racial minorities are going to be more vulnerable to poor health status as the rest of the population. So what are some of the reasons for that? Why are they more vulnerable to poor health?
Lower income,
Mhm.
um, communication barriers, language barriers.
Right? They may not,
Transportation.
right? They may not know what resources are available to them, right? They may be uninsured, underinsured. The low income, right? So that is what puts them at a higher risk. So one of the primary goals of Healthy People 2030 is to achieve health equity, eliminate disparities, and improve the health and well-being of all groups, right? So this is not just, getting them health insurance, right? It is getting them health insurance. It's getting them access to healthcare providers so that they can, do their routine screenings, so that we can have better health outcomes. Another one of the Healthy People 2030 goals is to reduce firearm related deaths. So gun violence is a risk factor for accidental injury or death among children. So when we look at someone who has fire, I worked in pediatrics. So one of the things that the doctor would always ask, is if there were firearms in the home. Right. And so, we want to know where do they store the firearm is going to be one of those key things, right? Is it out of the reach of kids? Do they have gun locks on there? They should be stored unloaded. They should be locked. The ammunition should be stored separately in another locked area. Um, Also asking like, what's the purpose of the gun, who has access to the gun, as well as training, right? So we all think, my kids grew up with firearms in the house. And so, you always, thankfully we never had any incidents, but you never know, right? Kids are very curious, right? We've seen the news stories and things like that. So, right, where it's stored, making sure that it is away from the kids. Um, Social determinants of health. Your social determinants of health also have an impact on people's health, their well-being, their quality of life. These, of course, are things like your safe housing and transportation, your safe neighborhoods. Racism, discrimination, violence also impact patient or people's health and well-being, their education, their job opportunities, their incomes, access to nutritious foods, physical activity opportunities, polluted air and water, language, and your literacy skills also have an impact on patients' health and well-being as well as their quality of life, right? Think about this as, when you go and you're doing your vulnerable populations project, right? This is kind of what you're doing. You're driving around your community and you're looking at these, what is the housing? Are the neighborhoods safe? Do they have parks, for kids to go and exercise or even adults to go and walk? What is the average educational level of that area? What is the job, is how easy is it for people to get jobs in that area? The average income, um, the polluted, water, um, air. Think of some people that live in some of the like bigger cities where they have maybe more factories, that can lead to air pollution, even water pollution, depending on how they are, um, getting rid of their waste. We look at introduction to vulnerability. So your vulnerable populations, these are your poor, your homeless, your pregnant teens, your veterans, your migrant workers, your immigrants, those that have severe mental illness, those that are substance abusers, have chronic sexually transmitted infections like HIV, hepatitis B, hepatitis C, as well as complex physical disabilities. Um, and so poverty is a primary cause of vulnerability. And unfortunately, it is a growing issue in the United States. Chronic stress, from not having enough income, not being able to pay your bills. It could be, work related. Also leads to maladaptive physical responses and disease, right? Maybe they turn to alcohol or tobacco or other drugs, um, which then can lead to diseases related to that. But chronic stress also causes its own issues within the body that we would, look to prevent. So education plays a role, but it's not just because it's related to income. Higher levels of education lead to better choices. It also influences the perceptions of stressors, the effects of stress. The more education or the higher education a person has, it also increases their self-confidence as well as resiliency. What is resiliency?
Um, that basically bounce back from what you're going through, like be able to come back from
Right,
stress
the
or whatever you're
ability
going through,
to
notice the
overcome.
signs and get back ahead of what you're going through, trying to stop it from happening.
Very good, very good. Um, and then disabilities, right? Complex physical or mental disabilities increase vulnerability as well. So outcomes. So when we look at without intervention, lower health status, increased morbidity and mortality, high prevalence of chronic illnesses, high levels of communicable diseases, they have higher mortality rates than general population. And so what can we do? So we talked about this, we especially when we talked about in class, we talked about, poverty levels and what are some things that we can do within the community to as those primary, secondary, and tertiary levels of prevention, right? So, things like looking at, more, making sure that they have stable housing, right? So they don't end up on the streets. Financial counseling, right? Those are some ways that we can help perform them and looking at jobs as well as education. So we talked about, right? We've been a big push for people to go to college, right? To get those degrees and but trades often are, more easily available. They can get training, generally can get a good job that'll pay well, that can support their families. Um, when we look at the complex physical and mental disabilities, right, of people that end up living in, poverty or living on the streets, right, we have to look at what are some things that we can do as a community to prevent that from happening. Whether it's homeless shelters, low cost housing, right, helping them to get into places, that will provide care for them. And then, of course, helping them apply for resources, whether it's the food stamps, the housing allowance, what else is out there? Food stamps, housing allowance, even Medicare, Medicaid, those kinds of services, right? So therapeutic communication is going to be key. One of the big things is these people are though, they're in a low level in their lives, they need assistance, right? And so we have to be able to develop that therapeutic relationship with them so that they get to trust us, right? Everybody is unique. They're all in a situation. For whatever reason they've ended up in that situation, they deserve respect. We have to treat them non-judgmentally. Let them tell you their story, right? Nobody wants to live on the street, right? Or to be in a situation where they can't provide for themselves or for their families, right? So, we're going to try to avoid making any assumptions about them. Recognize the role that resiliency plays. The more out of control they feel, the worse their decisions making becomes, right? The more out of control you feel, you know, you almost get to the point where you can't make a decision, or no matter what decision you make, you feel like it's going to be the wrong one, right? So they may just be out of control and unable to really think straight in order to make positive decisions. So that's that lack of, resiliency. Caring for caregivers of chronically ill. Um, think of, um, I don't know if anybody's worked with, anybody who's had to take care of, a loved one that has a chronic disease or even a debilitating disease, or even an injury in some cases where the injury has really been bad. But caregivers are, at risk for burnout and stress. They're also at risk of neglect and abuse of family members. So this primary prevention includes educating them on caregiver stress and burnout, teaching them stress reduction techniques, encouraging support group, looking for ways to provide for respite care. Have you guys heard of respite care before? Respite care is a great thing. It's usually offered, depending on the insurance company and other resources. It may be, up to a week's time, right? Just to give the caregiver a break. So even looking at our caregivers, screening them for anxiety, depression, neglect, and abuse, as well as those coping strategies, those are going to be your secondary preventions. And then same thing with homeless, establishing that therapeutic trusting relationship is key. A lot of them may be they may be embarrassed, they may be, very proud, they may be, untrusting as well, depending on their situation. So we really need to develop that trusting relationship with them. And so, that's going to be key, as well as helping them, to find those resources within the communities. Um, Homelessness is associated with poor health outcomes, right? We talked about that last week. The incidence of acute and chronic illness, your AIDS, physical trauma is significantly higher among homeless persons. And although they're at higher risk for physiologic problems, they also have greater difficulty accessing health care. And healthcare is usually crisis oriented, right? So when something happens, they'll go to the emergency room versus, using a primary, care provider, that kind of thing. those who access healthcare also can't, have a harder time following prescribed regimens, right? So imagine being a homeless person, you get sick, you go to the emergency room, they write you a prescription for something, right? You may not have access to go get that prescription filled. You may not have the money to get that prescription filled. They also, once that initial, crisis is over, they may not, follow through with follow-up healthcare. In some areas too, right? There may not even be access to free clinics or other places. And so that emergency room ends up becoming that revolving door. Um, Health problems are often directly related to poor preventative healthcare services. So, they're not getting their vaccination, they're not getting their screenings. Um, And again, they're not going to the doctor or the emergency room unless it's, gets to the point where it's almost life-threatening. So again, that's why, establishing that nice trusting relationship. And so, homeless people are usually given lower priority to health promotion and health maintenance, right, than to obtaining food and shelter, because food and shelter, right, that's usually those first things that people are looking to obtain. Um, they also have a reduced eligibility for entitlement programs like your TANF, your WIC, your Social Security. And does anybody know the reason for that? I thought this was interesting and I learned this. This was something I never paid attention to, and that's my fault.
Wait a minute, I'm sorry, you said, what about WIC and Social Security?
That they have reduced eligibility.
Oh, because you have a lot of households that while they're within like the poverty level, they're still like they make too much usually than the required, minimal or the threshold. They make a bit more than the actual threshold, so they don't qualify for everything.
It's also, yeah, that, and also they don't have an address.
That's
In that, like, that was one of the, I think, probably one of the
So,
hardest.
because they don't have an address, they won't be qualified. So that's what I never knew that.
Yeah,
Something.
because they can't get mail.
Right, right.
Yeah, and I was like,
Well, if they don't have a phone either, they can't contact.
right, but they're homeless. So what
Yeah.
are they supposed to do? Like, it's almost like a double standard, right? It's almost like you're darned if you do, you're if you don't, right?
Yeah.
I just thought that was really interesting. They don't have an address, right? So, and that's, I'm just, and I always forget where I learned that. But it was also like, even for like, homeless people trying to find a job, right? Not having an address is also, a barrier to them finding employment. So I just thought that was interesting. And I know even post office boxes, right? They charge you, right? I don't know how much a post office box is, but there is a fee for a post office box. So it's not like you can even obtain like a free address, right? So I just thought, I don't know why, I just thought that was really interesting. Um, but all the, other barriers to treatment, they may not know what their options are. Uh, and like I said, there's not all, some areas may have free clinics, or other places for them to go. Other areas may not. We look at like, our substance abuse, right? There may not be somewhere to go if you're in an area that has a high rate of substance abuse and only a certain a small amount of beds in a facility, right? They may not be able to get treatment that they need. Vulnerability can be reversed by obtaining resources to increase resilience. Um, and so, even learning basic language of the country of residence will give immigrants the ability to communicate, right, and navigate, even if it's, they have just a basic understanding, that can help to remove some of the barriers that are there. When we look at week 2 concepts, we talked about the school nurse. School nurse has a tremendous amount of responsibility. They are caring for school age children, right, from preschool up to graduation from high school. And so there's a variety. They help to, assess injuries. They also, may help with some acute as well as chronic illnesses. Students too. I noticed this. I never worked as a school nurse, but I had lots of friends that were school nurses. Lots of, when you think of, lots of stomach aches. It may not just be a stomach ache, right? It could be related to fear. It could be, stress related, whether it's in or outside of school. It also could be the result of those that are being bullied or abused. So a lot of, they play a tremendous role in these kids' lives, to try to, get to the bottom of it to see, what some of the issues are. Um, Unemployment, depression in a family puts the couple at risk for marital conflict, right? Which also can lead to adjustment problems for children. So they may have issues with, social and academic functioning. They also, work with kids that are from disadvantaged backgrounds. They may have poor living conditions, right? They may have clothes that are unkempt, clothes that don't fit, shoes that, are not proper for them. Um, and so we look the school nurses' interactions with families, should support the goal of establishing a productive and culturally sensitive rapport, to support effective communication and collaboration. So the school nurse has a huge play in the community. Not, they're working with the families, they're working with the children, they're working with other teachers, administration within the schools. They're also reaching out to the community, to identify community resources that may be beneficial in helping the students. Like some areas when I lived in Virginia, um, the city that was next to ours, they would have the school nurse would get like dentists to come in and just do like routine checks. They didn't do provide services, right? They're not going to fill cavities and things like that. But they can do just a routine, like a quick oral exam to see if there is any issues. They've had like the Lions Club come out and do eye screening, right, for those that may potentially need glasses, right? So there's a lot of resources that school nurses can provide. Um, Recommendations, as far as, even, teaching kids how to wash their hands, right? How to properly prepare food, insert their contact lens, there's, I don't know, anybody ever worked with a school and kids that have kids that worked with a school nurse at their school? School nurses can be great. They have a lot of resources that are available to them. They can provide injury and accident prevention education, right? They're going to provide education regarding vaccinations, and screenings, right? They work with um, the rest of the team at schools for your, individualized education plans for kids, like your ADHD kids and other types, of issues. And they
Yeah, I
triage.
was about to say they work closely with people with IEPs because my son has IEP. They work very closely with them with the eye exams and what they need to sit at in class and a lot of things.
Exactly. And so that's, a huge part of what they do. In addition to, working with kids that are sick, it's always going to be ABCs, right? Your airway, breathing, circulation. We look at, just the general complaints from headaches to stomach aches. But we also have to look at some, dealing with kids that have asthma, mainstreaming of children with, chronic and other diseases, like cerebral palsy or mental retardation, right? Things like that. They're mainstreaming them. So they may have to deal with G tubes and trachs, catheters, right? That may be part of something that they may take care of within the school. With growth and development, they're going to, educating about safety guidelines for infants, um, regular checkups, for growth and development. And I saw Cecily, you have a little one, right? They're at the doctor's office, especially the first 2 years of the life, right? They're at the doctor's office all the time. So really making sure that they are being assessed for growth and development, because early intervention is key, right? We want to identify any issues with milestones early so that we can get them into those early intervention programs, to try to catch them up or try to prevent a decline. With immunocompromised children, right? Education about how to prevent infections in the home, right? This is too is your hand washing, how to prepare meals. All right, so our common childhood ailments. So we talked about asthma, right? Asthma is the most chronic illness in kids. It causes recurrent bronchospasms, mucus production, edema leading to airway restriction. Most kids with asthma, it is related to allergies, right? So environmental pollutants and allergies. Some cases, food allergies can also trigger asthma. Extreme weather, whether it's very hot or very cold, can also trigger asthma. Some kids have what we call exercise or stress-induced asthma, which is brought on, by physical exercise or anxiety. And so they also, kids with asthma have the greatest risk of complications from secondhand smoke. So ensuring that we're providing a smoke-free environment. And, that school nurse too is going to play a big part in a child with asthmatic regarding, their asthma action plan, things like that. But, e-cigarettes are just as harmful as traditional cigarettes, right? So we need to try to keep them away from cigarettes and that secondhand smoke. Eczema is an immune-driven inflammatory condition of the skin. It is often associated with asthma and allergies as well. It's itching, inflammation, and dryness. So NSAID creams like Eucerin, Elidel, oatmeal baths are also effective with people that have asthma or eczema. Non-perfume soap, the doctor I work for always recommended Dove. It's very mild, it's not perfumed. It's also moisturizing. There are steroid creams and things that can be used if they're, if it's severe or when it's needed. Um, but treatment is aimed at relieving the itching, hydrating, lubricating the skin, as well as preventing infection, right? Think about it, kids that have eczema. I don't know if anybody has eczema, I have eczema. And so what ends up happening, you scratch, you break the skin, right? And we break our first line of defense, which increases the risk for infection. And then, helping to identify what the different allergens are. If we can identify the allergens, right, then if we try to avoid them, that will decrease their flare-ups. Type 1 diabetes is an autoimmune destruction of the pancreatic beta cells, which leads to insulin deficiency. So these kids will be treated with insulin, whether it's insulin injections or insulin pumps. Psychosocial complications are common too, especially for adolescents, right? They're going to feel different. They don't feel like they're, the same as their peers, which if you remember taking growth and development, right, that adolescent, right, their peer group is everything to them. So that's why they have a little bit of hard time when they become adolescents. One of the goals for kids with type 1 is that they will be able to measure their glucose levels as age appropriate. That helps them to feel a little bit more control over their illness. And as they get older, they should be able to, right, be more involved with their care. Acute conjunctivitis, right? This is your pink eye. It could be bacterial and viral, allergic. It is infectious, especially to the other eye, as well as other kids. Treated with antibiotic drops or antibiotic ointments. And once they start treatment, they can return to school within 24 hours. Scabies. Oh, can't do scabies. Um, so scabies is a parasite that burrows under the skin. It lays its eggs. It is spread by direct contact with person or indirect by sharing, bedding or clothing. So all people that come in contact with that person that has scabies needs to be treated. And so they'll put the lotion on from the neck down. It's Elidel. Put it on from the neck down. They'll go to sleep, shower in the morning, and then they'll repeat the process in a week. Just because the Elidel or the Elamite, it will kill the bug, right? But it doesn't have an effect on the eggs. So that's why we do it a week later to get rid of it. Linen, clothes, everything should be washed and dried in high heat. Anything that's not able to be washed and dried, can put them in plastic bags and store them for a week. Basically, that suffocates it, depletes them of oxygen, and they're usually good after that. Pediculosis capita, which is your head lice. Very similar. Itching, it's still a bug. It lies, the little nits or the louse lies near the base of the hair shaft, itching. They also may feel like little bites on the back of their neck. It is also easily transmitted through combs, hats, hairbrushes, or even just, kids in school sitting close to each other. It can go from head to head. It is completely unrelated to cleanliness. Lice actually prefer clean hair. The natural oils will actually repel the lice because they can't latch onto the hair shaft. If they are found with lice, they need to be treated. They cannot return to school until they are treated, and that just helps to prevent the spread. ADHD is attention or, distractibility. It is treated with oral medications, things like Ritalin, right? They, also may have some issues with coping skills, making friends, or even changes in their environment. So one of the things when we look at like kids with ADHD, is having them sit in the front of the back upstairs, having them sit in the front of the classroom. That will help them to focus a little bit better. You can kind of, have them in the front and center, give them clear, short directions. If you have like they're giving them chores or working on assignments, You want to give them short, clear directions, give them frequent breaks. Just like thinking about, your lecture at school, right? Nobody sits in a lecture for 4 hours straight. You get a break every so often. Um, Give them reminders, especially to take their medications. Other things too, we don't want to do with ADHD kids, like they shouldn't be, if they do act up in class, right? Don't take their recess away. Recess is one of the best things for kids with ADHD, right? It helps them run around, get rid of some of that energy. We don't want to isolate them. Um, Other things that we can do, um, and well, I already said that, right? Divide the work into, smaller chunks rather than all at once. Um, Iron deficiency anemia is most likely in our infancy as well as our adolescence, due to growth spurts, and in female adolescents due to menstruation. So high iron foods, iron in your eggs, your liver, your red meat, your green leafy vegetables, cream of wheat, dried fruits, beans, nuts, whole grain bread are all good sources of iron-rich foods. If it goes untreated, shortness of breath, extremity edema would alert the nurse to heart failure. Um, and it does progress slowly, but it can become pretty severe and cause some, really severe symptoms. Talked about scoliosis. This is the S-shaped curvature of the spine. Other things you may see, like one shoulder is higher than the other, one scapula is more prominent. The arm to body spaces may be unequal, or one arm may appear longer, right? So this is something school nurses may do as well, right? Screening should be done before middle school, right? And basically, I don't know if anybody remembers doing this in school, but this is where you would stand in front of the nurse, and you have your back to the nurse, and you would bend forward and touch your toes, and she is looking at the curvature of your spine. Right. So this is something that, a school nurse may do. I don't know if they do it anymore. I know they did it when I was in school. I know a lot of times now the healthcare providers will do it. But if we think of low income families that may not have the best access to healthcare, right, it may still be a responsibility of the school nurse. Lead exposure, the primary exposure is from old deteriorated buildings, right, prior to 1978. In children, lead exposure is often, we'll see developmental as well as cognitive delays, which the higher the brain level or the higher the lead level, the more damage it can cause. Um, and so treatment is going to be really based on what those lead levels are. But of course, the first one is going to is to remove the exposure, right? And then professionals will come in to remove the lead-based paint. And then there's chelation therapy. Chelation therapy involves the chelation therapy actually binds to the heavy metal in the body to help eliminate the metal from the body. We look at family nursing and family health risks. Obesity is the greatest risk for kids. It requires the community health nurse to provide teaching about prevention and management, right? So we're going to provide education about healthy food choices. Um, I always say go to, what is it? Myplate.gov is an excellent resource for parents to not only look to see what good healthy food choices are out there, but it also helps with like portioning, what they should not offer. And then we had our week 3 concepts, which we talked about some special vulnerable populations. Um, so migrant farm workers, we talked about exposure to pesticides, right? Chronic exposure to pesticides and chemicals can lead to cancer, memory loss, skin rashes, headaches are all potential side effects of short-term exposure. So this is where that primary, that secondary, right, is super important. What are some primary, we look at primary as prevention, reducing the exposure to pesticides is key. We also don't want them to bring it home, right? Dust on their clothes, to their family members. What else? They also, are at risk for the iron deficiency anemia just from poor healthcare access and poor nutrition. So we talked about this in class, what were some primary prevention measures that we talked about for our migrant workers? Anybody remember?
Educating them about like sun exposure, make sure they have their sunscreen, wear hats, if
Right, we talked,
possible.
yep.
Yeah.
We talked about the sun exposure. We talked about pesticide exposure. What else are they at risk for?
Tuberculosis, as far as like crowded living quarters.
Mm-hmm. Right? Stress, anxiety, other mental health disorders as well. So yep, very good. So primary things like educating again, how to reduce their exposure. Accident prevention measures is also something that we want to teach as far as a primary prevention, prenatal care for pregnant migrant workers, immobilization of healthcare, right? So whether it's vaccinations, dental, or even some, minor primary care. Secondary prevention, this would be like your testing programs for the, tuberculosis, the pesticide exposure, the skin cancer, the other preventable diseases, communicable diseases, anemia for kids. They generally, right, have inadequate access to healthcare, for lack of, insurance, or even, we have to look at too, their immigration status may be a factor in that as well, right? They may be afraid to seek healthcare for risk for deportation, right? If they are caught, they also may not be able to afford care, so they, don't use it unless it's absolutely necessary. Um, and then there's also, the fact that they're, maybe working in those rural areas where even access is far away. They may not be able to get to a healthcare agency. And then, of course, there's the language and cultural differences, that also may be apparent. Rural population is very similar to the migrant population, right? As far as access to health care, rural populations too, they're less focused on health promotion, right? So they are not going to, they may not see the reason for the health screenings, the vaccinations. Um, they also have higher rates of chronic disease, higher infant and maternal mortality rates. Um, there are more at risk behaviors, whether it's, working in the fields with the heavy equipment, working, you're riding what are those things called, like the four-wheelers and dirt bikes and things like that, may not follow those safety precautions. Um, They also are at an increased risk for skin cancer just because of sun exposure. There's also, right, the health or the stress related health problem. They also have poor mental health. With our homeless and are those that live in poverty. So talked pretty extensively about our homeless population, right? The homeless population, you know, the greatest risk of a child's overall health is the financial stability of the family. So kids that come from a low income family have an increased risk for disease and injuries. Um, and so, think about the unfortunately that highest segment of our homeless population, the highest growing segment is children with or families with children, right? So that is a significant issue here in the United States. So when we look at what are some things that we can do? This even goes down to, right, the school nurses can play a big part of this. But the homeless, what are some health issues of the homeless population? What are some of the risks for them?
Malnutrition.
Say everything, the heat, the cold.
Everything, yeah, it is everything, but right. It is malnutrition, right? Definitely the hypothermia, the heat related illnesses like your heat strokes, your heat exhaustion, sunburns, malnutrition, traumas, right? Think of even women, right? And what they're at risk for. Substance use and disorders that are increased risk for HIV and AIDS as well, right? So there's a lot of risks with our homeless population. So the overall determinants to health um, are your social and economic environment, your physical environment, your individual characteristics and behaviors. And so those are when we think of the social determinants of health, what are the things that we really need? So income and social status, right? Higher income and social status are associated generally with better health. Lower education is linked with poor health outcomes, more stress, lower self-confidence. We look at our physical environment, right? Is the air clean? Is the water clean? Do they have a healthy workplace? Is it somewhere they want to go? Safe homes, safe communities, um, social network. Do they have family, friends, communities? Right. And that includes the culture, the customs, traditions, beliefs about their health. So kind of just look through those. All right, I'm going to throw some questions at you. So we had a few more minutes. So, well, before I throw questions at you, does anybody have questions for me?
Like a definition for healthy people 2030. Is it just to like prevent, to like a simple definition of that?
Like, what do you mean?
Hold on, let me see, because I know it's different. It means something different for different areas, basically, towards like different
Oh,
populations.
okay. So
Right.
like the overall the
Basically,
Healthy
yeah.
People 2030,
Mhm.
it's a national initiative. It was set up by the US Department of Health and Human Services. And it's all data driven. Um, and so it kind of looks at the goal of it is to improve the health, right, and the well-being of people here in the United States. And so it does have core goals, right? The overall, like overarching goals for healthy people. And then it literally breaks it into like a million different pieces. So there's pediatric goals, there's older adult goals, there's OB goals, right? So there's a variety. Um, and so it's really kind of, there isn't like a real good set definition, because there's so much that's involved with it. Um, but the goal, the overall goal is to help, attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death.
Okay,
I've got
got you.
that
Yeah, that's what I needed.
memorized.
Okay.
Yeah. It's also right. We're looking at eliminating the health disparity or the health disparities. We're trying to achieve a health equity, as well as attain health literacy, right? So that we can improve health. So they're very, like, the overarching is very broad, but then it gets very specific when you break it into like the different parts. Um, so what are, let's see, when we look at school nurses, and let's say we have a child that, frequently visits the school nurse because they have stomach aches. What are some things that we would want to see, want to identify?
I'm seeing if they're being bullied or something going on at home. They might want to get away and tell someone about it.
Right.
Hmm.
Right. Very good. Very good. Yeah. So, what were you doing before the stomach ache occurred, right? Did something happen? Um, so with kids, we talked about kids in the homeless population or in families that are, have poor, lower incomes. We know that they are at increased risk, and they're going to be more affected by, right, their income. And so one of the big things that we worry about, one of the things, imagine going to school, and I grew up poor. So, one of the big things too is building relationships with other kids, right? If they're at a lower income, right, and they see, their friends have like the newest, nicest clothes, right, and the nicest shoes, right, they may have more of a difficult time building those social relationships. It's an adjustment period, it's an adjustment for them. Um, and so, um, this is something to think about. Um, we also talked about eczema. Just want to reiterate, some of the different treatments for eczema, right? The non-perfumed, the mild non-perfumed soap, antihistamines, also, especially like if they're really itchy and they're not sleeping very well, we can use antihistamines, something like Benadryl if it's not contraindicated, which can help to reduce the itching so that they can, protect themselves or to help them go to sleep. Um, what are some treatments that we can do for eczema, or not eczema, for pink eye, other than like, let's say, my eye is itching really, really bad. I have the medication, but it's still itching really bad. What else can I do?
Warm or cold compress?
Warm.
Warm.
Warm
Okay.
compresses. Yeah, always recommend warm
Warm.
compresses, not cold compresses. Um, Very good. Um, what is the, so at the very beginning, we talked about community-oriented nursing, community-based nursing, and we talked about public health nursing. Public health nursing, what does that focus on?
Is it like a group of people more than
It
individualized?
does, but public health focuses on preventive, not
Okay.
curative. Okay. Um, all right, any questions?
I do have some questions, not exactly related to the test, but more so this week's content for 208.
Okay, let me